I just hate COVID, hate it.
One of my patients started crying a few weeks ago as I was taking their bloods. They had not been touched by another human in weeks. Nursing is so hard sometimes. You have to love it.
Makes you proud of the NHS, but exhausting.
The day we had received the phone call about the first patient who'd been identified, and that's probably a day that, I'll always remember.
It was a Sunday afternoon. I was on call. It was early in March. And actually I was at a function suite in Bishopbriggs. We were preparing for a charity event.
The world at the time was still very much normal. In fact, that very day, it was a weekend, I'd been in central Edinburgh. There was a marathon which I took part in, and after the marathon, we sat out in a cafe. The world was normal.
And I got the dreaded phone call whereby the patient had been identified and were coming to Lothian and going to the Western General Hospital.
Our first meeting about the pandemic was actually the 9th of January. It was a small national meeting, and it was about cases of pneumonia of unknown origin from Wuhan, China. So that was what it was known as then. There was very little bit known about it. But the date does stick in my mind because when we went, we thought this is something with pandemic potential.
It was an interesting time for the Western General in particular because on the site we've got the Regional Infectious Diseases team who were particularly close to this and have been looking at pandemics for a long time.
And they're very sick with COVID, so they were having hourly nursing observations.
And they held a grand round event for the site, which are normally attended by 50 or 60 people in our lecture theatre. And such was the interest in the event that they held, because there was so much media coverage, as we know then, that it was a crammed event with standing room only, because everyone wanted to hear from some of the clinical expertise in infectious diseases what they thought was going to happen and what we'd been seeing unfold in other parts of the world.
I think moving through February and March, what I was principally doing was trying to work a little bit ahead of where we were and always try and think, what is it likely we're going to need? And what we were being told we would expect to need would be care for a large number of people in hospital and a large number of critical care patients. So we started doing the preparation around that. And that involves trying to make space for those people in a safer way as possible and thinking about how we could reduce other activity in a safer way as possible.
The weeks leading up to it, when it was all kicking off, in other countries, in Italy and Spain, so that was quite nerve-wracking.
There was a strange, the excitement isn't quite the right word, but worry wasn't quite the right words. We knew it was coming, we knew it was going to get bad, we didn't know how bad, we didn't fully understand the disease we were treating.
I think, the feeling was that that was inevitable and that this phone call would come at some point. So to some extent, it wasn't a surprise, and the team felt, I think, pretty well prepared because we had rehearsed this so many times before, and I think we all knew it was going to come.
It was only a matter of time. Since the coronavirus was first confirmed in Wuhan in China in January, the spread has been relentless. While Scotland remained virus-free, it continued to edge ever closer through Europe and into England, Wales and Northern Ireland. And in the last 24 hours, it arrived. The first case of Covid-19 in Scotland.
Well, we had the first positive case, which obviously came from NHS Tayside, but we had an agreement at that point as one of the units with the infrastructure to manage this case, which was being managed as a high consequence infectious diseases, so full PPE, full hazmat, because we knew so little about it.
In a full body suit and wellies and a big visor connected to an air supply and a mask and goggles and gloves. Our job was really to escort him safely into the negative pressure room. And then this is the actual room that the patient is taken into.
We very quickly devised a community testing team where we took ourselves and we were given a car and a driver out into the community to find the potential cases and test them there, so avoiding them.
This was the first community testing team in Scotland.
Yeah, and then from that we led to setting up the drive-through, which is still in operation on the western side. So yeah, we set that up and we staffed it just with in-house staffing and 7 days a week, and we tested in that about 4 or 5 weeks about 580 people.
And we had people outside, we had media outside.
Well, Sharon is outside Edinburgh's Western General Hospital this evening. So Sharon, what's the priority for the NHS to ensure this is contained?
Well, we're being told that the NHS does have the capacity and the services to cope.
And the infectious diseases team were going out and taking swabs from people in their own homes, and camera crews were arriving where they were. So I really remember that feeling of fear, because there was very little knowledge, very little evidence, and just an enormous sense of fear.
The World Health Organization says COVID-19 is now a pandemic.
People didn't know what to expect. It was the unknown. What you were seeing was media pictures from Europe and from other areas, and all the newscasts telling us what was happening there, but there was still a lack, I suppose, a real understanding of what impact that would have on this hospital site, what it would mean for people in their current roles, what would it mean for patients. Nobody really knew.
It sometimes felt like I was on speed dial to the whole organisation. Speaking to people I'd never had an opportunity to speak to in person before, were suddenly quite keen to just have a conversation and discuss some of the concerns that they had. A lot of those concerns related to, I think, keeping themselves safe, because I think for the first time actually in my career, really so confident clinical practitioners who are used to dealing with risk on a daily basis, I think could see that this was something quite different, and actually the perception of risk to themselves was very different, and to their families.
I remember sort of being quite worried about my own personal risk, because we were doing tracheostomies and we'd heard that these things were very high risk procedures for contracting COVID from patients. So it was it was quite worrying from the personal risk point of view that we might not be safe, or that the PPE might not be kind of effective for us.
I remember coming home in March, April, wearing my scrubs, worrying that I had been exposed to COVID and I was going to pass this on to my family. Getting the kids out of the kitchen, taking my scrubs off, putting them straight into the washing machine, going into the shower, and just being really fearful, but having this sense of responsibility that we were needed, and we needed to try and help people despite the risks.
As a community nurse, when you go and visit a patient prior to COVID, they could see your face, they could see you smile, and most of our patients are over 65, so some of them are hard at hearing, and with all full PPE, with the mask on, most of the time they couldn't understand what you were saying. And they would ask you, could you take your mask off? And for me, I just didn't want to take my mask off because I was seeing on telly that people from ethnic minority backgrounds were dying and contracting, and I thought, I just don't want to take my mask off. And prior to that, it wouldn't be a problem. You could shake your patient's hands, and some of these our elderly patients don't have family, or even if they had family, they didn't live close to them. So sometimes we are the only people that they see.
Tonight, the first coronavirus death in Scotland. A patient who is being treated by Lothian Health Board has died. We're told the person had been diagnosed as positive for Covid-19 and was older and had underlying health conditions.
The middle of March, we had a patient in the ward who was very sick, and it turned out that patient was Covid positive. And he ended up sadly dying, and he was the first Covid death in Scotland. Basically, that's when it hit home for us. And within, I think, a week of that, we had packed up our ward in 204 and we had moved to the other end of the Royal Infirmary.
We actually obviously knew that patient, and it was all them people could talk about as well. So all your family and friends, that's what they're talking about is, oh, here it's hit Scotland, this is us now. Everyone that you speak to after your shift going, so what's happening? How many cases have you got? What's going on? Is it as bad as everyone's saying?
The Western General is a hospital with about 30 odd wards and a number of different specialties. And one of the things that we, like all the sites across Lothian, had to respond to was working out how we were going to manage the pathways of patients into the hospital in a way that was safest for them and the staff involved. And we had to work out and look at where we had our single rooms, what the ventilation was like, and in a way that we perhaps hadn't looked at to that level of detail before, and how we could keep COVID and non-COVID patients apart. And in particular on this site where we've got a cancer centre as well, immunocompromised patients needed to be kept well away from those patients. And so I think it was the 13th of March was the day we were suddenly on to implementation of a COVID plan, and we turned one of our wards into a COVID receiving area and really made that change happen literally overnight, and developed what then became known as red and amber pathways.
We were the first people that went and staffed the COVID ward, and yeah, it was chaotic definitely to start with. Just upping and sort of moving the patients right down to another side of the hospital, going to a brand new sort of environment. That was actually probably one of the hardest things, I think. Trying to do your job when there's an extreme pressure on you and not knowing where anything is, and trying to get used to all of that, and actually none of your colleagues knowing where anything is. It's different if you go and do a shift in another ward, at least you can ask people, but we were all up to move to a complete different ward in the hospital, and yeah, it was just, that was probably one of the hardest things.
You can see we've got a big ICU here already, and we've also got a cardiac surgery ICU down the corridor. We'd already planned to use all of those beds, but we thought we probably needed more. And so we went into areas that we wouldn't usually use as intensive care units. So recovery wards and even operating theatres we planned to use. And on some of the NHS Lothian sites, we did actually have to care for patients in operating theatres when it was very busy.
And it's really difficult for staff because the supplies aren't there and it's not set up in the way they expect. So it's just an additional set of barriers. And then when you think about people working in full PPE, there are lots of photos and films that were done at the time about the physical impact onto critical care staff. And again, I think it's just exhausting to work like that.
it just felt surreal. Everything felt really surreal. You know, there was no traffic on the roads. I mean, I think it was just, when we came into work every day, it felt pretty much, you know, along with the anxiety around PPE and, you know, is this going to be all right for us? Because no one knew anything, and the PPE has been, you know, fine. But at the time we didn't know what was happening. So I think everyone was just really scared of the unknown. They didn't know what was happening.
Within a couple of days of lockdown, I'd moved into a hotel in the centre of Edinburgh and was coming so I could get to work without any issues with trains or because I was getting a train and cycling. And then coming into work and we had to start wearing masks and no visitors were allowed. It was really hard actually. I was working on the antenatal, postnatal ward, and I remember it was quite funny at the beginning when they made us put the masks on, because we were like, how will they know when we're smiling?
There was a huge piece of work undertaken by our e-health colleagues in a very short period of time to provide equipment, technology to support people in understanding how they could work from home and essentially be able to carry on working as if they were in the workplace. So that took, it didn't take as long as you might have anticipated. I mean, in very short space of time, hundreds of staff were able to go from the workplace to being at home.
The first thing that we planned was an upgrade to our internet connections. So we had to upgrade our internet connections, which were then at 1 gig to 5 gig and subsequently to 10 gig. So we started that planning actually in February and placed the orders in February, anticipating that in March things would get worse.
In terms of planning more generally, there is an enormous amount of work underway right now to increase NHS capacity and to accelerate plans to change the way people can access health services.
Well, we're used to seeing patients face to face. You know, we all went into general practice to have those really private, intimate conversations to make that human connection and just to try and help. And suddenly we were faced with a situation that it wasn't safe to bring people into the practice, and we were dealing with people on the phone, potentially trying and communicate by video, and it just wasn't the same. So just trying to get that balance right was really challenging, and we were aware that people were wanting to come and see us. It's very difficult to get through on the phone, and we were just continually trying to adapt to make sure that we were seeing the right people that really needed to see us whilst keeping everybody safe.
It was quite scary because we were told that our ward was going to become a COVID ward, and because we're obviously specialist orthopaedic, physio and OT team, and there wasn't really a need for physio to be on the ward, we were to be moved. So the orthopaedic team moved over to another building, which was actually a kind of shut ward that was reopened for us. And it was quite challenging because we obviously didn't have the nice gyms that we have here. We had to make a makeshift gym.
We doubled the touch point cleaning across the entire site. So when you consider the size of the site, it was no mean feat. We also did extra cleaning in all the public areas, toilets, touch points. You know, we were going around the lifts 2 or 3 times a day, making sure that the buttons were all wiped clean, that, you know, anywhere that was a frequent touch surface was wiped and cleaned more frequently.
I felt under a lot of pressure at the time, and so did the management, I know as well, trying to get the domestics on board, trying to reiterate that they are safe if they use their PPE properly. We are training them because we made sure everyone got trained again on PPE, just making sure that they knew what they were doing and they were confident.
So any child that came into the department, we had to limit numbers, so they were asked to come in with one parent only to the department. And then same, so if they were being admitted, then one parent would be allowed, but it had to be a designated parent, so there was no swapping over in between. So pretty much the person that came with them then had to be the person that stayed on the hospital, but at no point was any of the parents and children separated. They always had one parent with them or a carer.
I work with very young babies, and I was really concerned last March when I had a new baby on the ward, and he's been on the ward for a long time, and he had never seen anybody smile. Even his mum and dad, when they come in, were wearing masks, and that really got to me, because that's how a baby learns, is they look at you. So you've had to do it with your eyes. I feel as though I do a lot more with my eyes now than ever. So yeah, that has been a real challenge.
So to go through as a student, through the pandemic, it was quite a surreal experience. It was very much all coming together, student and staff nurses, and as a team on this ward particularly, I found. It was changing every day, every week. We had things changing, so it was just constantly keeping up with what the plan was, what was moving forward, at the same time balancing your studies and completing a dissertation and being then employed through the NHS to help boost the numbers.
Our volume of phone calls that we took massively went up, because you've got to remember these people are sitting at home, their relatives got COVID, they know they're really sick, they know that they could be going towards that, and they know they can't come in. And they're seeing all this on the news, and they're sitting watching it going, okay, what's happening to them? So they're phoning maybe 3-4 times a day because they can't come and see them. So you're doing your best to try and make all these phone calls and get through it and try and plan it, but at the same time, you at the end of the day, you go home and you think about all these people that you've looked after, and you just kind of had to sit down and go like, oh wow, and you had to turn the TV off and not watch what was going on with everything everywhere else, because it became too overwhelming, because it was like you were living in it in here, and then you were driving home on an empty street, and then living in it there as well.
The government guidelines told us we weren't allowed to have any visitors unless it was exceptional circumstances, and there was people that were dying alone without their families there, which was alien to us, because we deal with a lot of death on a day-to-day basis here, but generally we would have a family in and they would stay overnight, and we would let them visit whenever they wanted, but that totally changed. Nurses were sitting with patients that they had just met that day, they were sitting with them dying. There was conversations on phones, on iPads, and it was tough. It was really tough.
COVID really affected a lot of nursing staff in particular, because at any time, end of life care, the loved ones should be there. But if you've got siblings and there's 5 in a family, and that family has to choose one person, or it's the nominated person for the family, that has added dynamics to what you're trying to deal with psychologically. A lot of staff found they felt that they were letting the patient down. Of course they weren't, but you can't help how people feel. And patients often wanted more family members there, and it was very difficult for people to try and understand at the time what they could or couldn't do.
It's the families that were involved, and how it didn't just affect one person. There was husbands and wives brought in together. We did our best to make the family situation the best we could for them. Many a time we had a husband and wife in the same room, and sometimes one of them died and one of them survived. So things like that were difficult, and I think they're the things that stick in my head. And I think the things also that stick in my head about these situations are how wonderful our staff were with them.
One thing I always remember during the pandemic, working in the Western General, was the first time I went to ICU, because we have to be face fit for the FFP masks, because one side of ICU is what they call the bubble. So the bubble, you have to be full PPE, the lot, covered, your whole body's covered. And I went in there for the first time, and it was right in the height of the pandemic when it was really bad. And I'll take that image to the day I die, because it was horrendous. People lifeless, ventilators, and I was going back to people who were maybe dismissing COVID-19 or, you know, sceptical. And I was telling them that it's not a conspiracy. This is the real deal.
Oh, my mum got out and my mum died. And that was bad, do you know, because, and then you had to come back to work and it was still COVID, like everything was still raw, if you like, and I didn't know, like, you're coming back to, do you wear this PPE, are you allowed to do this, what's that, all that. But again, my colleagues were there every time, just do what you can, come this, that. I don't think you'll ever get past if you've lost somebody in COVID because it's so different. I just hate COVID, hate it.
I would say the main difference would be having your PPE on, and it felt very impersonal. Right, you can get the pennies. I'll get a fresh penny. Yeah. Where's the roll? Here we go. Here. Thank you. I remember somebody actually once said to me, "Go and just pull down your mask, let me see what your face looks like." Because there's been people that we have cared for who have never seen our faces. And I always felt that I was in that person's house. I would never ask them to put a mask on. So it was, yeah.
Or remember as well, showing that it was people who didn't have COVID that were palliative.
That's it.
And they didn't want to go in because it was safer to be at home. So already you're having to really upskill all your community nurses, you know, work together again, and do what sometimes would be done in the hospice, but we do what they do it at home, care for at home.
One of my patients started crying a few weeks ago as I was taking their bloods. They had not been touched by another human in weeks. Nursing is so hard sometimes. You have to love it.
People are more honest and more open and more aware of the need to support each other and just to check in. So are you really okay? I think the difference in the way people have approached risk in this have revealed that we don't all think about things in the same way, which we knew already. And I think that one of the reasons why this has been so hard for some people and less hard for others is that mixing of personal and professional life and fear. And so I don't want to breach anybody's confidentiality, but I know that there are some staff who in that first phase were so worried about the impact onto their family that they actually took themselves away. And I think the need to just think what is going on in somebody's whole life has become much more evident to us, and have more mechanisms to try and support that without being intrusive.
We've certainly become much more aware of the importance of well-being, and I think everyone would agree that was well overdue. It should have been much higher up the agenda for the organisation for years before, and so that's going to be a good outcome, that we are learning more about what's useful and what's helpful.
Understandably, there was a lot of anxiety, a lot of apprehension and a lot of fear for people. They didn't know what it would mean for them in a work context. They didn't know what it would mean for them and their health or the health of their families. So what we wanted to do as a hospital is understand, how can we support their well-being? How can we help them stay safe and come to work and do the job to deliver care for our patients? So we asked the question, what have we got in place that we can sustain and we need to keep going? But also, what else can we do to support staff and make it a safer place to come to work in? So we have worked so closely with Edinburgh and Lothian's Health Foundation. They have been a fantastic support to enable us to deliver meaningful support for staff. So they had a dedicated COVID fund that the public generously donated to and we were able to access. So we benefited from that in multiple ways. We were able to generate wellbeing spaces, so that was how we furnished those spaces to create much calmer, non-clinical feeling areas for staff to relax in. And it also allowed us to create what we called rest and refuel boxes, that were boxes delivered to wards with refreshments and teas, coffees, foods. So what we set about doing was creating a hub and a tub concept. So this spanned from having to think creatively about how we support our community teams. So on site we were able to put in initiatives because staff were all co-located, but in the community people are out and about in GP practices, in community services and home visiting patients as well to continue providing care. And we absolutely value their well-being, and we asked the question, how could we support them? There was also information on the other resources available to them, so the psychological support, the helplines, the national wellbeing hub. So as and when they needed it or wherever they were, they could access that support equally as a member of staff who was on a hospital site.
We were given a lot of support during the first wave. We received support from psychology, from the chaplaincy, from management. There was wellbeing rooms made available. These were made very quickly, sort of chill out rooms that you could go to and just chat over things with people. And that was amazing, and people made great use of them.
I think it's important for us to pause and to remember quite what a shock it was for everybody to be placed in such unprecedented circumstances. And we therefore set up the helpline pretty quickly because we knew that staff were needing to have that sense of connectedness for others. They needed to have their sense of loss of normality acknowledged. And they needed also to be able to have some advice as to what they needed to do and how to react, and what was sensible in terms of a way of managing with the very stressful circumstances they were placed in.
The foundation has enabled us to do our work. Without them, we would have had to think much more creatively or wouldn't have been able to deliver the standard we have. So we're grateful for everything they've done so far, and we're looking forward to continuing our partnership with them. So we're embarking on a really exciting opportunity to bring sustainable wellbeing spaces to the St John's campus, and in the months ahead we'll be looking to utilise funding from the foundation and all their expertise of arts and other activities to bring improvements to staff wellbeing.
When the pandemic hit and we went into lockdown, we needed to ensure that our volunteers were safe. So we asked lots of our older volunteers to stand down, and we used a risk assessment to do that. So we found ourselves in a position where we had around about 150 volunteers from our original team. And then 650 lovely people came forward. About 2,000 people contacted us and about 650 went through a fast-track recruitment process, and they were a very different age profile. Lots of those people were middle-aged and were on furlough, or were just in a position where they thought, well, actually my lifestyle is different, I'm working from home, I actually can be flexible and volunteer during the day.
I went through a large bout of depression before I started volunteering. I think I got to the lowest I've ever been. And by the time I kind of picked myself up out of that, the pandemic had kind of moved in and I wanted to give something back. Though I was in sales, you don't always get a lot of reward from that, but I just wanted to do more. I wanted to feel like what I did mattered. I went in and I remember working on 108 and Gary, the housekeeper, had said to someone, I'm just a volunteer, I can't do that. And he goes, no, you're not just a volunteer, you're really great help. I mean, I was doing tea rounds, I was doing water jugs, I was picking up stuff for patients off the floor. You know, you can only do so much as a volunteer. You can't do stuff like emptying a catheter bag or the stuff that you do as a clinical support worker.
When I volunteer at the AMU, I'm generally involved in handing around the teas, talking to the patients, listening to them, generally making their experience at the hospital feel a bit more comfortable, and especially with COVID, they haven't been able to speak to family members as much, so it's really nice for them to be able to have someone to speak to and to have someone listen to them. I
think for me, it's changed my direction. It's changed where I'm going, and it's changed changed me as a person. Currently, I'm a first year student nurse at Queen Margaret. It's a hard course, and you know, I'm going to come out a different person at the end of that. I'm a clinical support worker. I do some other care work as well. So the pandemic has given me a lot of opportunities, but opportunities to do the right thing. You know, for me, it's changed my journey, it's changed my life.
This is my first job in the NHS, and I've said many times I probably have one of the best jobs in the NHS because nice people come forward to volunteer. People come forward to give their time, and it really has demonstrated how much people care about the NHS and how much people value it.
That Thursday, as I cycle up the hill, it started. It felt like they were cheering me on. It made me smile. I felt honoured and proud.
We tried to really look after the most vulnerable, so I remember telephoning every 90-year-old in the practice, and I had this vision of, you know, really frail, vulnerable population. I remember speaking to one guy in his 90s who took an age to answer the phone, but it wasn't because he was, you know, really struggling to move, it was because he was mowing his lawn. And we got this really different sense of our community. And it was a time when there was such a visceral sense of support that the banging of the pans on a Thursday night just meant the world to us, and seeing, you know, rainbows in windows and seeing the painted stones that stretched nearly from Kirkensey to Preston Pans just really kept us going at you know, what was a frightening time for us as well.
So the clapping thing, I remember my biggest thing about clapping was when we were out at in our other ward and went over to the windows, and there was guys in their tow trucks sitting outside honking all their horns, lined up along the road clapping, and it was a patient who was getting a bit better. It was like, come in, nurses, get in here, and had us at the window. And I think up until then I'd been a bit like, oh, that clapping's just really annoying me. Like, it happened at my flat, and I didn't like it. I wanted to stay in my room away from it all. But when they saw how happy the patients were, that they thought, like, people are thanking you, that made me feel a bit nicer about it.
What made me feel valued was when members of the public would stand at the doorstep and clap. You know, I just thought, oh, people recognize what we are all doing, not me as an African nurse, but with my other colleagues. So I actually felt very valued.
We were overwhelmed with the support from the public, and we are unbelievably grateful for that. They gave us everything and anything to support staff through the gruelling conditions they were about to face.
So laboratory medicine is part of our diagnostics. And I think sometimes people are not aware of laboratory medicine, and that's success, because actually, nor should they necessarily be, because they expect their tests and the results on time. And actually not knowing about laboratory medicine is a success factor in itself. However, I think we absolutely were put on the map because we had to respond to the needs of the service. We were asked early on if we could ramp up our testing facility within Lothian. Glasgow, the North and Aberdeen and Lothian were all asked to increase our current capacity. We were able to increase that to something like 1,400 tests per day from around 300. So that was a significant ramp up in capacity.
For each initial case, we had an incident management team working with our partners, particularly infectious diseases, infection control, planning how the person could come in. They were kept in hospital sometimes for 10 days and had to have tests regularly and tests when they went home. Our job was very much about the contacts and preventing further spread. So everything at the beginning was really based on trying to contain as much as possible, trying to prevent further spread within Lothian. Obviously the main reason for that was for public health reasons, so that people didn't get the illness, but it was also about buying time for the organisation and the country to be ready for what was rather likely to come.
The plan at that time was that the National Centre would do all the simple contact tracing work, and that most of the boards would have small teams that would do the more complex cases. At the start of September, that all changed, and the government made its first indication that it was going to move to a much bigger contact tracing enterprise perhaps than was initially expected. And a letter came out at the start of September that said each health board had an expectation of a number of staff on every day. Now for us that meant we were to have 35 contact tracers on shift every day. So we reached out to NHS Lothian and we said, does anybody want to do overtime? It doesn't matter who you are, doesn't matter where you come from. If you have any spare time, would you like to work overtime and test and protect? And we got a really great response from that. So we got 60 or 70 staff straight away who could work in the evenings for us or who could work at weekends.
But as the testing strategy developed with the Scottish Government, there wasn't enough tests. So all of those regions, East, West and North, were asked to build some regional hubs. And we did that in conjunction with the NSS, the Scottish Government, where we looked to actually build 3 hubs in quick succession in a period of 2 months, I think, all in all.
How do you get a vaccine for something like this, or a coronavirus which is connected to the common cold? Will we ever have a vaccination?
So I first got involved in the vaccine programme about September 2020. I was aware that vaccines were coming along. We've got a clinical trials team within pharmacy at NHS Lothian, and they had been working with colleagues at the Western General. So we were quite excited about when this might arrive. It's probably around about September time that I joined the newly formed programme board, working with colleagues across nursing and facilities, and to start to design what a mass vaccination programme would look like.
So first of all, we needed a vaccine. So vaccine had to be approved directly from that. We needed venues, such as the venue that we're here in Gore Bridge. We needed staff, which was a big part of it. And at that time, the pressure on staffing across the system was severe because people had COVID, people were off looking after family, we were already feeling those pressures.
I joined colleagues on site visits to make sure that the premises that we were going to use for mass vaccination sites were appropriate, that the environment for the what we would learn to be reconstitution of the vaccines was appropriate, that we had refrigeration in place within these sites and that they were secure.
We didn't know what type of training was involved. So nationally, the vaccination programme is a national programme, it's not a Lothian programme. So the national team had set up training packs and put that into place. So what we did was, with other helpers across Scotland, we went out and we asked people who were retired or returners to service, and we gave them the opportunity to come and apply and work with us. We had nearly 2,000 people came forward. 1,300 people came onto the programme actually to work within there.
In tandem with that, I was then working with the pharmacy team to make sure that we got everything ready here at the pharmacy department. We had to make sure that we could receive these vaccines, which had to be stored at minus 70 degrees Celsius, which is not something we'd ever dealt with before. So we had to commission the procurement and the validation of these ultra low temperature freezers. We had to do the risk assessments to make sure the staff were appropriately trained.
The vaccine's stored between minus 65 and minus 70 degrees. So obviously if you touch that with your hands, you're going to get a really nasty cold burn. So we had to purchase these ultra cold temperature gloves so that we can handle the vaccine.
So this is one of our ultra low temperature freezers. The Pfizer vaccine, when it's delivered to us, is packed in dry ice, which maintains its temperature at minus 75 between the manufacturer and getting here on site. We need to immediately place that from dry ice inside one of these ultra low temperature freezers. So it took quite a bit of work from our quality assurance pharmacy team to come and help us set up this. A lot of validation checks that need to be done. A lot of resilience needs to be put in place to make sure this is hardwired and it's not going to turn off if there's a power cut, for example. And we had to consider all the security implications of having this here on site. We very luckily had a cold room that had just been finished, and that was to help out with our HPV school campaign. So we changed it, so we did all our packing down of our vaccine within here. We keep everything that we need for packing it down in here, and Stephen's got the packs that we pack it down into. Yeah.
So
one of the early issues we had, Laura, was that the tray is 1,000 doses, but we knew that there was staff going to care homes, and if we sent the 1,000 doses down there was clearly not 1,000 patients that could use them, and neither were we able to move the vaccine then onto another location. So that pack down activity was about creating smaller packs with the amount of vaccine exactly as was required, so that we were minimising wastage. But clearly, as Laura's described, that was quite an undertaking, given how many locations right across the whole of Lothian that we were delivering to on a daily basis.
And we set up a whole programme that was of mass vaccination site, of people at home, housebound. We've vaccinated travelling populations, refugees, homeless people. All these people all had to be factored in. So it's not just here in your mass sites that people have to be vaccinated. There's many, many other aspects of it, and care homes. Well, it was very evident from an early stage on from that, because of the way that care homes are designed, because of the population that are in care homes, COVID was having a severe impact, and sadly a number of people were dying at that time. And what we did was we wanted to have care home teams to work with them.
Lovely, thank you very much. Just leave it there.
So care homes, you've got to remember, are people's homes. They're not medical. And COVID was making them more medical in relation because they had people that were much sicker. They had a lot of problems with transmission, all these sort of things for that. And we had the expertise within healthcare to help support them. And it was support, because the care home's done a wonderful job throughout this whole programme. So my involvement at that time was to help set up the care home teams across the 4 health and social care partnerships. In 2 health and social care partnerships, they already had care homes. We set up a programme board to work with the care homes to look at what the big challenges were. And we set up a mutual aid programme, so where staff were off, they were able to come to us and ask for staff and help to assist.
The Edinburgh Care Home Support Team, basically off the back of COVID, they realised there was a gap between the care homes and the NHS. So they created this team to sort of work as a link. So all in all, we're basically a support service for the care homes. So most recently we helped deliver the vaccination programme. We do some staff training. We were doing supportive visits, whether that was walking around and giving guidance on infection control. So a bit of everything, really.
I think personally, when I see it going out to the care homes, that's when it really hits me. You know, that these people are so vulnerable, and it was great to see them being vaccinated, to see them getting their second dose now, to see them getting their booster.
We started to open mass vaccination sites And mass vaccination centres we opened right across the whole of Lothian, and say we're standing in one of those now. We realised that the only way you could do this was through mass vaccination, very quick, getting 3,000-4,000 people through a day was the only way that we were going to get the whole of the population of Lothian vaccinated. And that process was one that involved local authorities, business partners, various other people from that. So first of all, we had mass vaccination centres and some very much more localised, smaller centres which we put across. I think we had 16, 17 at one point, which were all working across there. But then again, we could realise that we needed to reach out more to people, so that alone wasn't its own right. And that's when we started moving to a time that was, was quite exciting actually for us, because we were having brainstorming sessions looking how we do it. And one of the things that came up was the vaccination bus. And that allowed us to go deep into local communities, particularly shopping centres and areas from there. And we went into those shopping centres and we were able to vaccinate many, many more people. The extension to that was we started opening shops. So we had shops at the Gyle, we've got one at Ocean Terminal now. And very quickly we realised that that was another way that people, when you talk about what's the centre of your community, and there's no doubt your shopping centres are the centre of your community. And by setting those up, and we set up one of the shops that we had in the Gyle, within 6 to 8 weeks we had 10,000 people had gone through that. And it made it much more accessible to people. So the Royal Highland Centre is extremely impressive. There's over 60 booths in it. So if you're looking around the environment we're in here, which is 9 or something booths that they have in here, it has 60 booths. It is a large, large warehouse. When it's fully working at full capacity, when it's under real demand, it is extremely impressive because the amount of people they can get through. The Royal Highland Centre can get to 6,000-7,000 people a day, vaccinate people over that period of time. It's a perfect site in many, many ways.
When you asked for help, you got it. People were willing to step up, and it was a very rewarding sensation to be part of a team, and knowing that we had so many people willing to assist, whether that was students being sent to help us in the workforce or volunteers, as well as all the community response, which was quite something at that time.
I think it's made us really look at the way that we work, and I think it's made us look at, whether everybody needs to be in the hospital at the same time. I think a lot of the stuff around remote working and sort of team using kind of digital solutions to working, although I don't think they'll ever substitute for face-to-face meetings or for face-to-face interaction. I think it's made us a lot more efficient.
I think the public and staff understand the need to protect themselves. They understand the need to protect patients and why these restrictions continue. And I think that for many of us, those are now commonplace, hand gels everywhere. So things that as an infection control specialist, we're actually really pleased about. And people's awareness of, keeping environments clean and clutter-free, those are all really positive things, not just for COVID actually, but for lots and lots of different infection risks.
Yeah, I think one of the moments that really stands out for me was at the very start of the pandemic when, it was a frightening time, and we'd watched videos of what was going on around the world and in northern Italy. And we were so busy here, and people had lots of questions. We didn't know what was going to happen. And I remember a really frantic Friday it must have been late February, trying to kind of keep a positive attitude in the practice, support the staff. And as I was driving home, I thought, I know who's going to be really worried. My dad's had a heart operation before. I'll phone him and answer his questions and try and reassure him that it's all going to be okay. And I think just hearing that voice of my dad, a loved one, I just burst into tears. And I had to stop at the side of the road, and I'm not sure that was desperately reassuring for him. But we got through it, and I look back at those times with just a real heightened sense of learning what matters, and look after the loved ones in your family. And
one of my memories, or there's a few people that I've got memories of, they were so sick with us in the very first wave. and they ended up going to the intensive care unit. There's certainly 2 gentlemen that are in my head, and nobody knew if they were going to survive. They were in intensive care for a few weeks, and eventually they did survive. And this was pre-vaccination, so you know they did well to survive. And they came back to the ward. We got them back on their feet. We got them better, and to see these people walking out of the ward was amazing.
Exhausting. Makes you proud of the NHS, but exhausting.
I couldn't be any more prouder. I've got a mask on and I just hope you can see the smile in my eyes. I can't be any more prouder of my nursing team. Registered, unregistered. But actually I can't be any more prouder of Team St John's, because that's what we are. We're Team St John's. But the nursing staff predominantly were the staff that were in the front line. And they did what they were asked to do. They did it with dignity, they did it with respect, and they did it caringly. And they did it with the professionalism that I would expect. So I couldn't be any more prouder.
I'm very proud of the team, and I felt that proudness one day on Princes Street on a Saturday afternoon as the shops had started opening again. I was walking down the street watching people going about some degree of normality in business and going into shops and whatnot, and I thought, you know, if we hadn't got the vaccine out in time and we hadn't been vaccinating the population, this wouldn't be happening.
Aye, I didn't really have the words to say how proud I am of them. We pulled together as a team, and I wouldn't want to be anywhere else at this point in time, to be perfectly honest.
I mean, I think we will all constantly look back and think, oh, what about? And it's going to be one of those time points in people's lives that everyone will reference back to. But I'm so proud of our staff and the way they've responded. I think it's been fantastic. I appreciate it's been a huge amount of hard work and a lot of hurt for people in the things that we've asked them to do, but they really have come through for us.
Hands of a healer, face of a feeler, help me when I could not help myself. Words of a poet, but I doubt you know it. What a gift to this world you are. And if I could hold you, I'd never stop, and the thank yous would pour out. Lags of an army, but you would never harm me. There's not a rank high enough for you. In the strength of a boulder, with softness of a shoulder, at 2 a.m. when I need one to lean on. And if I could hold you, I'd never stop, and the thank yous would pour out. The thank yous would pour out. There's not enough words that I could say to you. There's not enough cards that I could write to you. There's not enough flowers I could give to you, but the thank yous would pour out. The thank yous would pour out. thank yous we pour out. Hands of a healer, face of a feeler. What a gift to this world you are.